JJ, a 79-year-old veteran, was prescribed 3 antidepressants at the same time by mistake, which led to many reactions that nearly put an end to his life. Hello everyone, I'm Dr. Magnum, a second-year pharmacy student, and today I want to talk about this medical case which really hits really close to me because this semester we're diving into the CNS pharmacology, and we're talking about antidepressants and stuff like that. And it's really like we're learning these things, and so, I just wanted to make this video to share my knowledge of medicine and science with you guys. If you're interested in that, subscribe, like. So in this video, I'll talk about how the case progressed, diagnosis and treatment of JJ, and because antidepressant is becoming widely used these days because of the rise of certain mental conditions like depression and stuff like that, I think it's really important to talk about this topic so we are more aware of the drugs we're taking, and at the end I'll discuss everything, so please stick to the end. JJ is a 79-year-old veteran, and he has a medical history of general anxiety disorder and PTSD. And he presents to a family medicine clinic complaining about worsening tremors and persistent itchy rashes. Now, he basically received treatment from different healthcare providers targeting, for example, these things, but that's not known. Okay? He has been prescribed citrulline, duloxetine, and atomoxetine for different conditions. Now, these are all antidepressants, but in the science of CNS pharmacology, this is the thing that I'm dealing with this semester. It's really not fun. If you tell any pharmacist what is the hardest part of pharmacology, they'll talk about CNS, because one drug cannot be just used for one issue. One drug can be used for many issues. For example, antidepressants are the first line of the defense for anxiety, and also they are used in cases of PTSD. And our patient here he's been prescribed 2 drugs, citrulline and duloxetine, at the same time, which is for various conditions, but they're in the same class. But then later on, he was prescribed atomoxetine by a nurse, which is an SNRI, basically similar to duloxetine, but it was for a different issue. It was for rashes and tremors that we've taken this medication for. But this rashes and tremors didn't actually get better, it got worse. So what is the deal here? He developed a case of serotonin syndrome, which is basically because they are all working on serotonin, serotonin increased in his CNS. This problem, in this case, diagnosis was really hard, and it was not easy to diagnose this case easily because he was not taking these drugs from the same place. He was taking these drugs for different conditions from different places, and there was a lack of patient-physician continuity. Basically, the physicians, they didn't know that JJ was taking these antidepressants from other places for a different condition that he was having. So they didn't know that JJ was taking the same medication class. Instead, they actually had a suspicion of Parkinson's disease because JJ also has a family history of Parkinson's. And that was sort of their first suspicion, which is completely wrong and completely inaccurate. But then they did a medication review, and then it was confirmed that JJ was actually taking multiple drugs of the same class and action, 1 SSRI and 2 SNRIs. And that kind of cleared a lot of things for our doctors here, and that's where our case gets a little bit juicy. He was developing a case of serotonin syndrome because he was taking these drugs. So I'm talking about serotonin syndrome all the time. So what is serotonin syndrome? Serotonin syndrome is a case where there's an increase in serotonin in our CNS. And it happens because we're taking multiple medication that are they're basically serotonergic, right? They increase serotonin in our body. They could be SNRIs, SSRIs, but also there's some certain other medications, for example, allergy medications, stuff like that, that also increase serotonin. So you might take an allergy medication and also an SSRI, and you might develop a serotonin syndrome because in your body serotonin is becoming more. Serotonin is increasing. Now, serotonin syndrome has a bunch of symptoms, which are hyperthermia, which is increase of the the body temperature, muscle rigidity, because serotonin and dopamine is getting more and it's basically affecting our muscles. Hyperplexia colonus, which is a condition where I wanted to show the footage here. I'm going to demonstrate on my own leg. Basically, Alright, this is so embarrassing. They do this thing with your leg. Your leg's really like getting flexed here, but then there's a colonosis, which means it's like there's a shaking here, right? So that's called hyperphagia colonus, and this can be a sort of something that can happen in a serotonin syndrome, and of course agitation and tremors, kind of explaining why. Or patient JJ was complaining about the rashes and the tremors. And here's the thing: they were like, "Oh, this could be an early case of Parkinson's," but then they realized, no, this is because of the serotonin syndrome, and sort of like it's an easier fix. Okay, now here's the interesting thing. I'll talk about it, but this case didn't develop instantly. It developed over 3 months. So this JJ was taking these medications for 3 months straight, and he was really consistent on it. He was not someone who took. I'll talk about that later. Anyway, so this is how it works. In your brain, we have these neurons, okay? We have the presynaptic neurons and the postsynaptic neurons. In between them, we have these vesicles, right? These vesicles, they contain dopamine and serotonin and these monoamines. What happens is that these vesicles go bind and they release their content into this thing called the synapses or the synaptic cleft. So the way that these drug SSRIs and SNRIs work is they basically block the reuptake of these neurotransmitters, and the concentration of these neurotransmitter in the synaptic cleft is going to increase, and that's going to lead to more actions. For example, it's not going to directly increase serotonin, but there's going to be more serotonin to do their work. Right? In normal condition, the excess serotonin will be reuptaken back to the presynaptic neuron, but in this case, when you're taking this medication, what happens is that the serotonin will not be reuptaken. They're going to stay in that synaptic cleft, basically acting and doing their action. What was the treatment for our case here? It was pretty easy. In our case here, it was just basically they told JJ to discontinue the medication. But in certain other cases, we have supportive care, for example, IV fluids and cooling measures. Remember, I said that one of the symptoms of serotonin syndrome is the hyperthermia. It's because of the dopamine and serotonin, they increase the body temperature, and so cooling measure is one of the treatments for serotonin syndrome. In some cases, they use benzodiazepine and cyproheptadines. These basically sort of work opposite to serotonin and norepinephrine and all that thing. They're more inhibitory, but I'll talk about benzodiazepine in another video because it's also a very interesting drug that it's called sort of used recreationally. I want to just talk about this. Hey guys, so I'm Dr. Magnum, second year. Of course, not my real name, but anyways, second year pharmacy student, and I'm trying to do these videos because I see there's a lack of like really medical videos, and I really want to just do these videos. And I'm new to this, so if you guys can please support me, that would mean a lot to me. Like, subscribe, share, and link down below. There's a way you guys can donate me Bitcoin and Ethereum. Anyways, let's get back to the video. So, discussion. There's a rise of certain conditions that require SSRIs and SNRIs to be treated and managed, and that can lead to a higher chance of serotonin syndrome being developed. And serotonin syndrome is a case where there's low clinical suspicion for it. So in our case, for example, JJ, they didn't think of serotonin syndrome. They instantly went, oh, this could be an early case of Parkinson's disease. A lot of clinics, they don't think about this, and there's a low suspicion of serotonin syndrome, which makes it really, really dangerous because these cases will be they're not going to be diagnosed properly, and the patient's cases can elevate and into like more extreme conditions. And this case really highlights the lack of clear conversations, patient-physician continuity that I was talking about. So what happens is that you should be really, really aware of anyone who's taking these medication so that they don't take it with another medication and increase serotonin in them. And JJ developed serotonin syndrome. It didn't happen overnight. It happened over 3 months. Okay, so this serotonin syndrome might not happen instantly, but it's going to happen very, very slowly. And you'll be like, okay, why is my anxiety not going away? Why is my conditions are not getting better? Well, maybe it's because serotonin syndrome is sort of developing really, really slowly. So what happens is, like in a case like this, when there's so much serotonin and dopamine, after a point, it will actually work by blocking the receptors because there's too much of it. So that's why, like, there's also like I want to talk about this, like they had suspicion for Parkinson's disease. In Parkinson's disease, dopamine is really low, so that's why they're given carbidopa and levodopa, which is basically they increase and they turn into dopamine, which is used for Parkinson's disease. So yeah, in Parkinson's disease, the muscle rigidity, the shaking of the muscles, these muscular symptoms of Parkinson's disease are due to the low dopamine. But in this case, it was because he was taking too much serotonin, too much dopamine. It was actually blocking the receptors. So at the end, fortunately or luckily, our patient had a quick recovery. They discontinued the medications and they went back. They cut the medication that the nurse gave to them. So he cut down on the medication, and also, yeah, he got better. It didn't really lead to something that was more extreme because we catched it earlier. This case really highlights the importance of clear communication between patient and physician, especially when there's multiple healthcare providers that are doing this thing at the same time. We learned that mistakes can be made, so it's better to always check up something and ask questions where things are not clear. So this is sort of like a wake-up call for the patients. If you're taking this drug, I think you should probably, like, if you're seeing that your symptoms are not getting better, they're actually getting worse, it's never a bad thing to ask. I don't know why patients here, they don't research these things clearly. Of course, that's because there's not a lot of resources, and that's why I'm making these videos to raise awareness on these conditions. But it's never a sort of like, there's no shame in asking. It's okay to not know. It's okay to ask. Actually, it's more encouraged. If JJ actually wanted to ask. Okay, this is the thing. JJ really wanted to ask, and it was like, what is this? Why are we taking all this thing? But the clinical, like sort of the hospital system, they're really slow with it. They didn't reply to him quickly. But that's the thing. It's like, we can fix these things. Yeah, the system is broken, but what can we do? The thing that we can do, that we have control over, is asking questions and talking about it. And there's nothing sort of bad about asking. So this kind of brings us to the end of the video. Thank you for watching this video till the end. I think this video is way better than the previous video that I made, but still, like, I have a lot of work to do. So please, guys, like, I'm new to this, so if you guys can like, subscribe, and support me down below. As I said, I have my Bitcoin and Ethereum wallet. You guys can send me and gift me, because it's New Year's. I didn't really receive that many gifts. I got one gift, and it was a toy, and they broke it. Like, it was a these squishy toys. They broke it. I couldn't even have the opportunity to bring it back home in one piece. But yeah, I'm really happy about that, and I would appreciate your gifts too. Anyways, so yeah, that's the end of the video. Thank you, guys. Stay curious.